Hi and welcome to the Henry Schein Surgical Update. Today we want to update you just a little bit about the BIOLASE Epic X laser, and I've got my colleague Jackie with me today, and we just want to run you through the journey. You may already have a laser and you want to upgrade to a new laser, or you just might be starting your journey on lasers, and today myself and Jackie just want to take you through that process, how to start and just how to get you on that journey with it. Hiya Jackie.
Hello, how you doing?
Good, thank you, good. So this is the Epic X BIOLASE laser, and just for people who don't know a lot about lasers, what basically can you do with it, Jackie?
Well, I think you could describe a laser as, number one, obviously people hear about you can use it for cutting. So it cuts, but it also cauterizes, coagulates, but it's anti-inflammatory. So you can use it for infection, you can use it if you have bleeding, hemostasis, and also for pain. So to be honest with you, it's a lot more than a cutting tool. And also the fact you've got this healing property, so you're stimulating the healing cascade. So in some respects, if you use an electrosurgery unit, you really are only looking for cutting, but you're looking for something that cuts without bleeding. So if you could get a perfect cut, which would be about cutting without bleeding, without swelling, with less pain, then you've got that in a laser.
Cool, brilliant. And I would say, I always find when I'm talking to people, they think that it's a bit of a one-trick pony and that, but these things can do so much more than that.
I think when people start using lasers, they start to realise that it's a problem solver. And I think that many people who are watching today will probably realise that if they're working with soft tissue, it's unpredictable. And so if you could use something to control something as unpredictable as soft tissue, and also you can stop bleeding. So these are the areas where we have the most problems. So let alone infection, obviously big problems we have now with antibiotics. So if you could use a technology to reduce the amount of antibiotics that you're prescribing, then this is where you can use lasers.
Definitely, definitely. With the Epic X by BIOLASE, with it you get two surgical hand pieces, and you also get a whitening hand piece as well. The whitening handpiece is also brilliant for low-level laser therapy, which you can also do with the BIOLASE Epic X. So I think you get a real assortment to get you started on your journey.
The whitening handpiece, I don't like to call it whitening handpiece. I call it the intra or extra hole whitening handpiece, or pain therapy, because you can use it for soft tissue management, as far as if you have ulcers, cold sores. You can use it for desensitization because it's quadrant shape, it's kind of ergonomic, so you can use it on the cervical margin in that respect. You can also use it for TMJ, so bio-modulation, pain therapy. And in ortho, we're using it a lot in ortho now because of, there are some good studies on speeding up tooth movement. So there's, really it's about getting more research on low-level laser therapy. And we're using it less on whitening these days because we don't really have the bleach necessarily. So I would consider it to be more about desensitizing.
Yeah. And as you say, it's brilliant because it's got such a larger head than the smaller head as well. You also get an assorted pack of tips in there as well. I think you get
surgical and perio, and there is also endo. They're not in the kit, but the difference between the tips really is also this is almost a fibre, so it's connected to the fibre here. And they are very easy, they're disposable. They come in different diameters, depending on the sort of tissue type. They come in different lengths, depending whether you're just using it for surgical or if you're going to be using it for perio, or endo is even longer. And they're also bendable, so you can use them, and it's ergonomic. It means that you can reach into those areas with the patient. And the handpiece is really light. I mean, some of the sort of handpieces you've seen in lasers before, where you try and put everything into a pen, they become really cumbersome, but these are very light, and the actual fibre itself, it will reach a long way. So if you're working with a patient, you can leave this on your tray, or your nurse can hold on to it. As you can see, battery operated. So again, Bluetooth foot switch. So ideal, ergonomic, and you can reach the patient.
Yeah, so it doesn't take a lot of space in the surgery at all, and it looks really nice as well.
Okay, Michelle, we talked a bit about the laser and the benefits. If I was a dentist and maybe I haven't got a laser yet, what would be my next step? How would I get that experience?
Many different routes that you can take. Obviously, there's lots of reading, lots of online. We have a dedicated surgical team at Henry Schein who we're more than happy to come in and do a demo for you. We can bring the laser along, you can have a little play with it and just feel how easy it is actually to use and how nice it is to use in the clinical setting. So we can do that for you. We also have a full webinar if you want to look at more clinical information, which you'll find the link at the end of this video. So we'll pop the link on for the webinar as well, that you can sit and watch at your leisure. We can provide you with a full handover when you do get your laser and make sure that yourself and the whole team are happy with it as well. So really the next step is get the laser in your hands and have a try of it. So give us a call, bring in one of the surgical team, we'll come to you and say we can demo it. And there's nothing like trying something to actually say, you can read lots and lots of different things, but to actually try it and feel how it works speaks absolute volumes. And that's what most dentists find when they use it. Once they've tried it, they like it.
I also think that's very, very important as well, because if you're just setting out and you haven't got a laser, you can buy many things online, but you don't get that one-to-one relationship. And I think that's so important when it's a new technology, that you have someone to hold your hand and teach you the first steps, because I think to me that's, you know, if I was a dentist...
And so we can come in and do a full handover for you with yourself and the team on how to look after the laser, make sure that you're using it safely and that all the staff know that they're using it that you're using it safely.
Get maximum benefit, because there's loads of things you can use it for, and make sure that you're not just using it for cutting.
Yeah, lots of people just think they've got it there, it's just used for one thing, but we can go through all the different benefits that you can use it for.
And get some patients in the chair to help us.
Exactly, definitely. So yeah, that's the best thing to do, is to contact the surgical team at Schein and we can come in there and you can have a go with it then. So we've put together a few questions, myself and Jackie have, and we're just going to do a little quick fire round on questions and answers. It's just quite a few of the questions that we find that we're asked most commonly in the field and that, so we hope you find this a little bit useful. Fire away, Jackie.
So one of the questions that happens a lot is from a dentist who hasn't used a diode laser before, is, you know, how can it cut? Can a diode laser cut nicely in soft tissue?
A diode laser cuts very, very effectively in soft tissue. Obviously, as you're cutting, it actually seals at the same time. So I say it cuts and it seals at the same time, so you don't get that bleeding there. Big mistake that dentists usually first make when they first pick up a laser is they use it like a scalpel. So they put it in and they just drag along as if they're cutting a piece of meat as such. With the laser, because it just cuts at the tip, it's almost like a feather in action on top of the soft tissue, and then you get a really nice cut. And as I say, it cuts and it seals at the same time, so you get a really, really good quality cut. But it's just getting used to doing that.
So it's slowing
feather in motion.
Slowing down,
then putting it in, drag across, just feather on the top of the gingiva.
So it's like cut and then move, right?
Yeah, yes, definitely. So no, but you get a beautiful cut with it then, and it's just learning a new skill set with it.
So one of the things I know that with electrosurgery unit, you can't go anywhere near metal, because obviously it's pretty aggressive cut. I've heard that diode lasers you can cut around implants. Is that so?
Yeah, excellent for cutting around implants. Again, you get the sealing when you do cut around the implants as well, so you don't get the bleeding. So obviously, if you're taking that impression straight after, you get a beautiful quality impression because you've got really nice gingiva there. One little tip when you're cutting round an implant, if you've buried the healing cap, just pop your screwdriver in and just locate the centre of the healing cap. Give it a quarter turn just to raise it slightly under the gingiva, and then you'll see the outline of the healing cap. And then with that, you can just follow around the outline with the laser and you get a perfect circle round. Yeah, really, really neat.
And no bleeding?
No bleeding.
So you're going to save your patients an appointment if you can do an impression on the same day.
Yeah, so you can do your impression on the same day, whether it's a digital impression that you're doing or whether you just do a conventional one.
And I'm guessing you could use your low-level laser therapy over your implants at the same time.
Yeah, so and then that helps
stimulating
with the healing as well. Yeah, definitely.
Excellent. What about using sort of a diode around a class 5 or your subgingival decay?
It's brilliant for around a class 5 because, as you know, and most dentists know, it's so frustrating and takes a lot.
Time is of an essence.
You're trying to put the lining material in, you take the cotton wool pledgelet out, blood just floods back into the cavity.
Exactly.
With this, you can contour the gingiva round by the class 5 cavity.
Brilliant.
It seals it, stops the bleeding. It's just like filling a normal cavity then. It's a lot more comfortable for the patient because They've not got to sit there while you're still trying to stop the bleeding, and it's a lot quicker for the dentist as well. So time and motion study works brilliant on Class 5.
Big problem solver.
Definitely, definitely. It saves lots of headaches with
I
that.
bet, I bet. Going back to the low-level laser therapy again, I guess this can be useful if you've had a patient that's been open for a very long time, whether it be an implant or an endo or a large cosmetic treatment, and the patient's jaw is pretty painful. I guess for biomodulation, you can use this for pain therapy.
Yeah, and that, as you say, it just fits beautifully into the TMJ joint with the patient. So following a long course of treatment, as you said, cosmetic, implants or endo, anything like that where the patient's actually keeping their mouth open quite a long amount of time, just use this couple of minutes each side on the TMJ, and it's just the heat and the warmth and the biomodulation on the joint, and it just stops that aching, stiff jaw afterwards. And it's a brilliant practice builder because patients remember this, and it's just a nice,
that's what they remember.
Nice heat. Yeah, they tell their friends after, if they've got a friend who's been for a long course of treatment and they've not had anything like this.
Yes.
You can guarantee the friend will be moaning about how the jaw was aching afterwards, and they'll be, well, my dentist used this and it didn't ache afterwards. So it's brilliant for that.
I guess you could also use that to actually open the jaw in the first place, because you find some people that have got a big treatment, then they can't open the jaw if you're doing a big implant and you've got to do it at the back of the mouth.
Yeah.
You know, sometimes, you know, it'll loosen up the jaw, so you can
with
open
the
up.
stiffness of the jaw,
Yes.
and if they've got a clicky jaw as well, it all helps with that.
Excellent.
So many uses with that as well.
So do I have to get an extra consent form for using lasers?
No, there's no extra consent form because purely it's just another tool. So you've got a scalp and an electrosurgery, so it's just another tool that you're using to actually cut through. So you don't need a patient to sign a consent form to say that you're using a laser on them. So it's just the same as normal treatment. Definitely. A lot less stressful dentistry for the dentist and more comfortable for the patient. If you would like a demonstration, then please don't hesitate to contact us and we can pop into the surgery and demonstrate the laser for you, and you can have a go with it there as well. What we'd like to do is, if you've got any questions, and we can answer them for you as we want to do future videos. So just pop them in the comments box below and we can answer those questions for you. Look forward to seeing you all next time. Thank you.